Hello, everybody. Welcome again to having a chat with our 2019 conference CLCA speakers. Today we have Jaye, Haleryn, and Mohr. They will be joining us in BC in less than a month. And before we get into discussing these, having a nice discussion with these speakers, I just want to remind you all that registration is open until October 11th, so you still have time to get in there and join the fun learning experience. We have a couple of workshops offered. We also have presentations lined up for the 2 full days. We have some light receptions. We even have someone coming in to get our yoga on. We also have exhibitor tables and some sponsorships and some poster presentations as well too. So it's going to be a great experience. It's been a while since Canada's had a in-person learning conference. So it's time that we all meet again and learn together. And for those of you, I just want to remind you that there is an Air Canada discount for those that have to travel across Canada. And there are rooms available in the Westin Hotel right where the conference is held as well. So welcome, Jaye and Jewel. Thank you very much for being here today with us. These conversations are just meant for us to kind of get to know the speakers and prior to hearing them on October 25th, 26th, and 27th. So Jaye, tell us a little bit about how you got into your career as a lactation consultant, but also all the other credentials and other specializations as well too. It does mention here too, which I just want to point out, that you too also had struggles with your breastfeeding experience, which kind of was the kickstone for becoming an IBCLC, which I think is interesting because I find a lot of IBCs have that story, which I know, Jewel, it's mentioned in your bio as well too. So I just kind of want to hear a little bit about that and that journey for yourself, Jaye, and then Jewel, if you can give us a little briefing on that too, that'd be great.
That's good. Well, so in 1994, I had this little boy named Benjamin, and the first couple of days were okay, but by day 3, I was having some difficulties with breastfeeding. And needless to say, it took about 2 weeks, I guess 2-3 weeks, for me to even find somebody to get help. I had never even heard of a lactation consultant. And a friend of my nurse at my doctor's office heard my issues at the 2-week appointment, and she said, you need to go see this person, who then sent me on to somebody else. And basically that's how I learned what a lactation consultant was. But we struggled with some pretty severe breastfeeding issues. The trauma to the nipples is the worst I've ever seen on anybody in my 25 years of practice. Oh. Thank God. That's me. I'm like, I'm okay with that. So that's kind of where we started. Within the first couple months, I was introduced into the WIC program here in California, and it's the Women, Infants, and Children program, and I became a peer counselor for them. I was the first peer counselor to become a certified lactation educator through the Lactation Institute, and that was in January of 1995. So this boy was barely 4 months old, and I was already hooked and in and learning. From there, I started learning about structure and function starting in '96, and that kind of spurred me on to just continue the education. So in 2005, I decided to take an infant massage training class to teach parents how to work with their babies and do infant massage with their babies. And I really, because of the clientele I was working with even then, which were babies who were high needs, special needs, not necessarily developmentally disabled, but I also consider babies with structural issues to be special needs because they are so sensitive to input and to touch and to this and that. So my infant massage classes were tailored around those clientele. In 2010, 9, something around in that time frame. I lose track of time nowadays. I became a Bowen therapist, so I took all the training to become a Bowen therapist. So all of those different educations and credentials and whatnot, they were not done to necessarily practice on anybody other than my wife, who loves the fact that I can do body work. But I don't practice on anybody else. It was for the education on how the baby's structure and function, what they're supposed to be, how things are supposed to work, what to look for, all of that, to really understand the body and how it functions. So my career started off with seeing the normal stuff, the latch and position, and then towards the last, I guess, 5 years was really very, very, very heavy into babies with serious structural issues, serious neurological, struggles, and really complex, gnarly cases that nobody else could figure out, and I could. So that's why that's me in a
Well,
nutshell.
thank you, Jay. And for yourself, Jewel, can you walk us through your journey as well, too?
Sure. So my journey started when my fraternal twin boys were born in 2007, and they were 34 weekers. So they spent time in the NICU, and we had so many different challenges. So we had, well, I had to pump, and I had delayed milk production, and I had one baby come home after 10 days, and luckily he just decided breastfeeding was for him and we didn't struggle there. But I had the other one still in the NICU for 3 weeks, so we were going back and forth between pumping, breastfeeding, and then the one in the NICU just gavage fed and practicing, but it was mostly just hanging out and getting used to being with mama. So when the little one came home after 3 weeks, we still had the whole like latch and positioning was not really the problem. It was just everything else. Like he just couldn't do it. He was just weak, and so we did everything possible to continue protecting my milk supply and keeping him growing and trying to transition to breastfeeding. So after about 3 months of just being persistent, he did transition to breastfeeding, and we were able to breastfeed until they were about just over a year old. And at that point, it just made me very interested in lactation and helping others so that they didn't have to struggle and go through what I went through. So around, 2012, I got back in contact with Jay because she had helped me out, Jay, with helping me with breastfeeding my twins. And I became a Breastfeeding USA counselor. And then I started shadowing with Jay as my mentor and got to go and learn hands-on all about this. How do you be a lactation consultant, and what is the structure and function, and how can that affect lactation and breastfeeding? And so then I went from there to becoming an IBCLC and was board certified in 2015. And since then, I've been working as a private practice LC and just learning as much as I can as far as how to help these families. I see a lot of complicated cases because Jay retired, and I then was taking on her cases or her referrals from her clients and prior clients because they needed that extra insight on what exactly is going on with my baby, because latch and positioning isn't working. I've done everything possible, and so now I go in and I can help and find out what's going on with these little babies that need extra help. So that is pretty much it, and I'm super excited to be part of presenting, helping others learn about the importance of how structure and function affects babies, and how we can help them in the short term and in the long term.
We're very excited to have you both there as well, too. So to go back to kind of dissect a little bit of what each of you said. So Jay, as you learned more about the structure and function, as you progress through becoming an IBCLC, supporting other mothers, going on to infant massage and Bowen therapy, etc., were you able to reflect back to what challenges you were having with your little one and kind of
Oh,
piece it back together and be like, aha, oh, aha.
oh, absolutely. In fact, in 2012, I realized he had a posterior tie.
Mm.
But in 2013, when I have this picture that I use of him in the program, and I put it up on the screen, in PowerPoint, and I'm like all looking at it, and I'm like, oh my God. And my wife and I had just gotten married, and I was livid. I was livid. I was so angry and so emotional because I saw his structural issues. And my poor wife was like, please don't throw the dishes. They're brand new. We just got them. Because sometimes when I get mad, I need to throw something. And they were right
Oh.
there on the counter. And so it was that moment of recognizing that he had structural issues on top of a posterior tie that had me going back through all the baby pictures, that had me going back through, everything that we struggled with, okay? Because, like Jewel, we did a lot of pumping, we did suck training. He was off the breast for a solid 6 to 8 weeks. We were not a fully nursing dyad without any pumping or anything else until he was 4 months old.
Oh, wow, what a journey.
So, yeah, so there was a lot of trauma that he caused that took a very long time to heal. Okay, so there was a lot into that. So once I had that recognition, for me, all the pieces fell into place, and then they fell into place for myself for some of the issues that I have dealt with and struggled with over the years, including current issues that forced my retirement. So, and we will get into those in the program. But yeah, so it's the more you know, the more able you are able to go back and kind of sort out what happened. And so I've done that with a lot of my clients with their older babies, or if they came to me with an older baby, I learned to be a really good detective. And what is beautiful and amazing for me is that this gal came into my world again in 2012 and decided that she wanted to pursue this option, and now she's sitting right next to me, and I will tell you this, she is on top of everything more than I ever could be, and she has the brain for this kind of stuff. I mean, I've got a good brain for this stuff, but hers is spectacular, and she will take the structure and function program and continue to add to it. What she's already brought to the table for this program in the last 2 years is astounding. It has made it better, just so much better. So I am grateful to have been able to, one, help the families that I've been able to help over the last 2 decades, but to be able to pass this on to somebody who has the same passion for it as I do, but who can actually take it forward, because I can't.
Wow.
It's not high praise. It's actually, for me, it's like, you are amazing.
Aw, this is so sweet. It's a reality, Julie. You're bringing the program to a different level and helping build on the foundation that Jaye has created. So that's amazing. And whoever is in your area is very lucky to have you guys or Jewel
Yes.
help support their breastfeeding then. I think that many IBCLCs will mention as they learn more skills and learn more knowledge about infant feeding, they're always reflecting on, oh, wow, that's kind of what was happening in my own journey. And I think that really adds a lot of emphasis to the practitioner sometimes, in the sense that when you're very passionate, that you never want someone to experience some of the trauma or the negative stuff that you've experienced, right? So you become this detective, you become this well-skilled, knowledgeable person who can really help prevent some of that versus just triage through the mess at the time, right? So
Yeah.
that's that is really helpful, I think, for many of us IBCLCs. I too noticed 2.5 years after breastfeeding well, he was about 2.5 years when I noticed he had a posterior tongue tied too. And he's 5 now, and we still struggle with it because of the speech. And we literally just came back from speech therapy today, and he's had a release of the lip and the tongue, but the tongue grew back. We need to go travel down south, unfortunately. But yeah, and it makes me, when I'm working with my families, really a strong advocate for my families as well too, because I'm like, no, this is what we need to do. We know now through research this isn't 1995, where we didn't really have the supporting evidence, nor did we have the support as a profession. Oh man, have we ever grown. We're so thankful for all the pioneers of the profession, who have come before us, and like yourself, Jay, who have walked that walk for us, to be able to really advocate for our families as well too.
Yeah.
So Jewel, you must be able to be quite helpful for the families who have twins, and I'd have to say for some IBCLCs, we may only see a handful, depending on the how big our practice is and the area that we live in. So tell me a little bit about your supporting. Do you have a lot of twin families in your area?
Well, it's helpful that I am part of a local Parents of Multiples club, and
Okay.
in our area we also have I think 3 or 4 actually. So I'm friends with lots of multiples, and so with that, it does help with referrals. So
Mhm.
yeah, so I have helped quite a few twin families with breastfeeding, and with that comes a lot of the more issues as far as structural issues because they are in utero and they're cramped and squished. Also, there's a lot of preterm or premature
Mhm.
babies, and that can also complicate breastfeeding and also contribute to structural issues. And so, being able to be a mom of multiples and having my experience, and then knowing the complications that can contribute to um, breastfeeding challenges or even just feeding in general, has been really helpful. And I'm able to give them really good support and back up what my recommendations are.
Mhm.
So, and also with that, having looking at my twins now that are 12, and looking at it from when I was first working with them, and I didn't realize because I was just a mom and I wasn't a lactation consultant, not really knowing what was going on, and I too have realized how many of the problems that we dealt with were related to structural issues. And
Mhm.
I started getting them help with body work when they were 5. So
Oh, okay.
a little late, but it still helps a lot. So
Absolutely. Yeah, it's better late than never, I guess, there goes the expression, right? Yeah.
yeah, yeah. And I know there's some people that will say to me that, oh my gosh, must be so hard to have twins. But really, if you have a singleton, it's the reality of it's hard no matter what. So whether
Absolutely.
you have a preemie that's twins or triplets, or you have a preemie that's just one, it's difficult. And so any support that those families can get is beneficial.
Hmm. So if you work often with twins then too, I mean, I suppose there's a lot of work in helping them get breastfeeding going, even if they're in the NICU and when the baby's not on breast. So a lot of hand expression, pumping, and those other strategies as well too to help them transition, from utero into the NICU and into home.
Right. Yeah, there is. And it really does start with yeah, they don't generally just come out breastfeeding. So
Mhm.
yeah, it's protecting the mom's milk supply, helping them emotionally so that they can maintain the pumping routine and finding a routine that can work for them. And also helping them know that it's just little teeny steps, like you just accomplish each day, sometimes each hour instead of each day, and finding out, let's not look at the whole picture, let's look at, okay, what can we do today what can baby do today? And maybe that's just being in arms at skin to skin and knowing that that is also a step towards being able to be breastfeeding. And there's lots of, transitions in between. So yeah, it's just helping them not be overwhelmed so that they can reach their goals.
I think that is so important. You mentioned about just taking, the hour by hour, small steps at a time. One of my slogans or sayings I say often with families is let's just take one feed at a time.
Right.
Then we can even progress to just one day at a time. But let's do one feed at a time because it's so overwhelming. And the moms I work with mostly around here are singletons. So I can just imagine what it would be like for a mom of multiples, how overwhelming it could be to even just look at 3 days ahead when that's going to be, potentially 30 to 36 feeds for two for each, right?
Yeah.
So one feed at a time seems to be, okay, let's accomplish this goal right now. So.
Yeah, and knowing that the babies are individuals and they are not going to be the same. So
That's
you really
right.
have to look at them as individual, what they can do, what they can't do, what are each individual goal for that baby. So.
That's really important too. That's a really good point. So each of you have been doing some presentations or for certain platforms around the world. Can you give me a little bit background on some of the teachings, the facilitations, and some of the presentations that you guys do around the world?
Well, I'll start with me because I've done more than have you done any?
Just with you.
Just with me. Okay. So basically, I started speaking in 2013, doing online webinars and teaching the structure and function program. That's basically where I started. And I was invited to speak at a few different conferences on structure and function. And then also, I also brought in the LGBTQ education for lactation and birth professionals. And I started that in 2013, 2014. And so I've done some speaking at conferences and then also online on that as well. I would say as far as like platforms, I love the online stuff. Love it, love it, love it. I love online teaching. It's easy for people to access. It's a lot less expensive than going to a conference. But the in-conference stuff is a lot of fun for me as well, although it's overwhelming. I have a neurological disorder that is basically why I'm retiring. But I would say my two primary topics are structure and function, and then LGBTQ awareness. So that's, I'm not sure what else you would want to know about that stuff. That's basically what I've been doing since 2013. Oh, wait a minute. I also did some, Jewel actually helped me with some in-person like clinic days I used to live in this huge house. And we would bring in LCs from wherever. We'd just say, everybody come on over. And we'd bring in live babies and the moms and parents. And we would have like hands-on training. So we would do a short lecture and then do hands-on training. And that's one of the things, to be honest, I'm like really looking forward to our third section on the clinic day, where it's the hands-on. We're going to talk to and work with everybody hands-on. And I'm hoping, I know everybody's being asked to bring baby dolls to work with, but I'm really hoping that we get some live babies in there as well, because there's some really important points that I want people to understand when they're working with live babies. I mean, we'll touch on it, but still. So, yeah. So.
Yeah, we're working on the live babies as well too. we totally appreciate how much more helpful that would be, not only for you in facilitating, but also for us participants and being able to bring to life some of the teachings as well too. So, and Jewel, are you enjoying doing the conferences as well too with Jaye? And do you think that you'll continue a similar platform that she's been doing as well too as you progress through your career?
I do, and I definitely enjoy the online forum, and it's a great way. Using the live meeting format is wonderful. So even though we're not meeting like physically in person, we can still see each other, and we can ask if we have normal, conversation, instead of just sitting at a computer watching a slide go by, where there's actually a Q&A where we're talking and looking at each other. So it feels like we're all in the same room, but we can all be in a different state or country and it will still work. So I definitely will continue that. And I'm looking forward to the CLCA conference and being live in person and meeting everyone. And I'm also open to doing more conferences and even small in-person training, so with groups. So yeah, I'm super excited about it and look forward to it. And also, I'm thinking that as prior to being an IBCLC, I worked as a elementary school teacher. So hopefully that just makes me feel calm. So yeah, so I'm looking forward to it.
Because this is your first conference, huh?
This is my first conference. Yeah.
Oh, we're so lucky.
Yes,
Yay.
Well, and the fact is, I would not be able to do this by myself. And I've been invited to speak at the conferences, and I've said, yeah, no, I can't do it by myself. And I can't. And so having Jewel with me enables me to, one, go teach, because I do really enjoy it, but also I've got this great person sitting here next to me, and we are very different in personality, but it works beautifully. So yeah, so I hope that she's asked to speak at other conferences, and I'm sure she will be. So
I think so.
She's gonna do great.
I'm excited.
Good. So now that we're talking about the workshop, it's a 3-part series, correct?
Correct.
And can you just give us a little briefing on what to expect for the conference, and how is this going to help us as healthcare practitioners? Because there's going to be, potentially and hopefully other professionals who are not IBCLCs, such as doulas or midwives, etc. How is this going to help a healthcare practitioner when they're working with the breastfeeding diet?
Well, for one, so part one, the first section is what I'd like to call the what, where, or what, why in the long term. So we talk about what causes structural issues, why they happen, what do they cause, what issues do they cause or contribute to, and then what's the long-term effect if these structural issues are left untreated, which sadly too many babies have structural issues that are left untreated. Okay. So that's the first part. The second part, then we get into more of the visual assessment. Let's take a look at what we're looking at. Let's see what's going on with these babies. How do you recognize these things? We talk about a little bit about musculature, a little bit about, the body, how it's supposed to function. We get into some neonatal reflexes. We talk a little bit about the neurology. I discuss my personal diagnosis and how my hypothesis is that it is a long-term result of my own structural issues as an infant. We then, in part 3, we go hands-on. So we get to watch videos and see, learn how to really look at the whole body, not just the little bits and pieces here and there. We're looking at the baby as a whole for a long-term health outcome, not just to get the baby breastfeeding.
Mm-hmm.
So what can this do for the practitioner? Frankly, for any practitioner who has eyes on an infant, on a newborn, this is a really great program because it can alert them to, some potential challenges that this baby may have, whether it be with breastfeeding or behavior or long-term development. So it's good for anybody, okay? Whether you're a doula who is just assisting at birth, or you're a midwife, or you're an IBCLC, or you're a pediatrician. We've had pediatricians, we've had chiropractors, we've had speech and language therapists, we've had people in all sorts of modalities who work with babies take our program and love it, which is like a heck of an honor. But I actually look at this program as being structure. It's like a structure and function 101. This is the basics. This is to get your feet wet, to get you started, to start looking at babies in a little bit of a different light and a little bit of a different way. And it's simply another tool in your practitioner toolkit. It's one part of as working with babies, whether you're an IBCLC or not, there's a whole bunch of stuff that goes into working with these little ones. And this is a very important piece that, in my personal opinion, forget the professional opinion, in my personal opinion, if everybody who ever laid eyes on a newborn in a professional capacity understood what to look for and why it was important, there's a lot of issues that these babies would not ever have to deal with, because they would be getting treatment right from the get-go. So if somebody had been able to look at Jules' twins, you know, when they were born, and say, you know what, these babies need some treatment, and they had been able to get into treatment, I firmly believe that they would not be struggling as much as they had. Okay, they wouldn't have had 5 years of catch up for treatment. You know what I mean? And the same thing with my son, and the same thing with me. There are things that would not have happened because the issues would have been fixed right at the get-go.
Mm-hmm.
So that's kind of where I take it from.
Okay. And I wonder too, when we're doing the workshop, we'll be able to identify the structure and function.
Oh, yes.
Will we be able to assist them beyond that, or will it be mostly like we'll be able to continue assisting them with the lactation, but will we be able to help with some of that therapy or?
No, we do not teach how to do therapy to infants, because in my professional opinion, if you do not have the appropriate licensing, credentials, training, etc., to put hands on an infant for therapeutic purposes, you are crossing your scope of practice boundaries in a big way. So you need to be able to recognize what's going on and refer out for care. And that is very, very important. We do discuss working with other practitioners, and we do touch on how to work with other practitioners and how to talk with them and how to find them, so that we can be supportive and help the parents basically make good choices, help the parents continue to go to their care providers. What would you add to that? Anything in particular?
Yeah, so there's lots of different types of body work. There's craniosacral, pediatric chiropractors, osteopaths, just to name a few. And sometimes it's a matter of the parent being educated to learn like what exactly could be the better option for their baby. Also, or just being able to interview some of the body workers in their area, and knowing that they can figure out, you know, which one will be the best support. So it's mostly just helping, you know, the practitioners or health providers that are attending the program to be able to educate themselves and the parents and families they work with, so they can find out what type of modality is going to be the best help.
Okay, that makes sense. So that helps us understand a little bit more about how to connect or who to connect with, right? And trying to figure out, you know, well, and it may come down to who's available in the community as
right.
well, who's trained as well too, you know, who, because not every osteopath, physiotherapist, chiro, you know, will be versed in this area. I mean, you would have your cranial sacral therapist, infant massage therapist likely, you know, that may be more versed in this just from their school as well too, but not all chiropractors and pediatricians and everyone will be able to accept the referrals if they're not able to identify and understand the link between these structure and functions identified and how it affects the baby, you know, in that moment and long-term as well too. And before we close, I think that you mentioned something interesting about how this workshop's going to give us information and education on how to help not just the immediate structure and function of the baby and how it affects them now, but also long-term. You'll be bringing to life that. And I think in essence, that is what breastfeeding is all about, is we're giving them optimal health now, but we know that it's also giving them lifelong health, you know,
Yes.
setting them up for a healthy foundation. So it's just really just blends right into the whole essence of what lactation is all about, is the immediate health and the long-term and the generational health outcomes as well too. So that's amazing. That's a great piece to add to the profession as well too. So I am so thankful to have you guys here today, to have a chance to talk with you, lovely ladies. And I really do look forward to the workshop. I want everyone who's listening to go take a look at the CLCA 2019 conference webpage. If you haven't already registered, you have time to. If you've registered for the conference and haven't signed up for a workshop, you still have time to sign up for a workshop as well too. If you know of anybody that would be interested in even just attending the workshop, you know, sometimes it's not of interest for some of the other healthcare practitioners to attend the three-day workshop, three-day conference, but perhaps this hands-on experience workshop with Jaye and Jewel will provide you with lots of education to be able to further support your families as well too. So I encourage you guys to share this video and share our postings on our social media as well too, to help people in the area learn about the education opportunity that's going to be hands-on, which we're really excited about. So, well, thank you very much, Lee, and we will see you in less than a month.
Yay.
Thank
Thank
you.
you.